Welcome to the debut episode of Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Michelle Wargo. We bring you useful information about staying healthy and answer some medical questions you may have. We'll cook up recipes for healthy bones, and we'll show you how a visit to the emergency room can be a very different experience. First, everyone gets a stomach ache at some point, whether due to overindulging or eating something that just didn't agree with you. Sometimes the source of pain can be much more serious, caused by disease that has progressed with little or no warning. If the pain is intense but only occurs occasionally, you may be tempted to take an over-the-counter medication and wait for relief. But some symptoms may occur more often, and in fact, may be signs that something is wrong in another part of your body.
People come in a lot with thinking that it's their stomach, and it's not. No, often it is your stomach, but one of the things, for example, that can be a cause of right upper quadrant pain or pain that's up in your belly is pneumonia. And people present with a pneumonia in the lower lobe, and they think it's actually in their belly, but no, it's in the lung. So one of my standard lines is to, when I'm talking to patients, is to say that your insides are sometimes a little stupid. By that, what I mean is essentially, unlike your skin, when you touch your skin and you can tell exactly where someone is touching it, on the inside where you're feeling pain isn't necessarily where you're having the disease that's causing the pain.
Dr. Sevli Gabramedi, or Dr. Sebi, as she's known, explains that physicians can identify the clues our bodies give, even if the symptoms seem unrelated to the real source of the disease.
For example, if you're telling me you have right shoulder pain, oftentimes that's a marker of gallbladder disease. And the reason that happens, there's a good reason why that happens. It's because there's irritation to your diaphragm, which is the muscle between your belly and your chest. And when that gets irritated by the inflammation of the gallbladder, the same nerves that control that control your shoulder.
Gallbladder disease is fairly common, affecting 10 to 15% of adults. And while the gallbladder plays an important role in our digestive system, our bodies are able to adapt when the organ is surgically removed due to disease. Dr. Sebi says common symptoms associated with gallbladder disease include pain in the upper part of the belly or in the back, feeling bloated after eating certain foods, especially fried, fatty foods, feeling nauseous after eating, or even frequently vomiting or having diarrhea. It's also common for people to lose weight because eating makes them so uncomfortable. Gallstones are a common symptom of the disease and are formed in the gallbladder. Once they travel out of the organ, that's where the discomfort begins. Dr. Sebi stresses that you should never discount chest pain and assume it's the gallbladder. If the discomfort is great, she recommends seeing your doctor or going to the emergency room so the source of the pain can be properly diagnosed and treated. And while you hope you never need to use the hospital emergency department, we all want to know it's there and that the physicians, nurses, and staff are ready for anything. David and Bonnie Goodman of Eustis are grateful that the Florida Hospital Waterman emergency team was ready for him when they were in need. While at home, David suffered a severe heart attack, and Bonnie sprung into action, calling 911 and doing CPR. The ambulance brought David to the hospital, which had recently invested in a new, state-of-the-art cardiac catheterization lab, designed to better diagnose, stabilize, and treat cardiac patients. Goodman became the first patient to benefit from one feature of the new equipment, the new icing machine.
What we're doing is we're lowering the body temperature and we're maintaining that body temperature with the hopes of preserving brain cells or preventing brain tissue from dying.
I know they iced him down. They had this big special bed that sends ice water through and around him, and icing him down, I believe, is what saved his life. He was asleep. He was in a coma for 2 weeks. He didn't even know I was there.
To do the icing directly in the cath lab, not as two separate procedures, it's the first time I've ever done this. And that type of innovation is what you want in a hospital.
We desire so much to really treat them as if they're our own family members, for them to realize that we're here for them at any time, with any type of ailment and for any reason, really. And I would say that our goal is really to make their stay as short or as long as needed, Really, that depends on their safety.
Dr. Putina says Waterman's emergency department sees approximately 55,000 people each year. To further help you appreciate the medical advances available right here in our community, we'd like to take you back in time to see how far medicine has come. This antique electrocardiograph was used to help diagnose heart abnormalities, quite different from the sophisticated equipment in the cath lab we just showed you. Recently, some Lake County physicians got to see a display of old-fashioned equipment as a way to appreciate how far medicine has come. The history lesson included a tonsil guillotine from the 1930s. You won't see many physicians carrying one of these doctor bags anymore. More likely, they have a smartphone or tablet device in hand to help them diagnose and treat patients. Coming up after the break on Waterman Wellness, are you leaving an important task out of your child's schedule? We'll fill in the blank. We'll go to the kitchen to learn about good for your bones foods you should be eating. And you may be surprised to learn where you're most likely to fall and hurt yourself. These stories and more are coming up after the break. But first, Waterman Wellness presents some upcoming health and lifestyle events, classes, and seminars that can help you stay on the path to wellness in our monthly calendar. Stay tuned. Welcome back to Waterman Wellness, your path to healthy living. I'm Michelle Wargo. There's no question one of the most appealing things about living in Florida is that you can enjoy an active lifestyle year-round. But when you experience chronic joint pain, your ability to enjoy anything, whether indoors or outdoors, is difficult. It affects your quality of life and that of your loved ones. Medical advances in joint replacement procedures now allow for minimally invasive treatments that involve less recovery time with long-lasting results. Lake County residents should know that access to nationally recognized state-of-the-art care is right here in our community. Florida Hospital Waterman is the first in Lake County to earn a Joint Commission certified Gold Seal of Approval for knee and hip replacement. The Joint Commission, an independent not-for-profit organization that certifies thousands of U.S. healthcare organizations, has recognized the Joint Replacement Center for its commitment to the highest level of safety and quality of patient care.
We were, the first hospital in Central Florida to start doing minimally invasive surgery for hip and knee replacements. One of the first hospitals for sure, if not the first, back 10 years ago. I think as a department, orthopedic surgeons, we've been very upfront. They're very on the cutting edge of the latest developments and surgical techniques as they've come around.
Dr. Radnothy says orthopedic surgeons can operate using smaller incisions and utilize better pain control so patients have a quicker return to normal function. A resumption of her normal activity is what Barbara Hurley of Eustis sought after enduring chronic pain in her hips.
My husband and I like to ride bikes. I used to walk, could not do any of that. Couldn't work with my husband because I couldn't function on my legs. Couldn't get down, couldn't get up.
At the recommendation of her primary care physician, Dr. Stephen Tang, Hurley met with Dr. Samir Guru, a local orthopedist, and decided to have hip replacement surgery here rather than go to a specialist in Orlando.
Dr. Tang referred me to Dr. Guru, and I had full confidence in Dr. Guru and Dr. Tang, and if they thought that this was the place for me to be, I took them for their word. I had that much trust in both of those doctors. The minute I arrived, people were right there attending to me, making sure I was comfortable. The therapists were wonderful.
With the specialized care and advances in medical procedures, the prognosis for joint replacement patients is quicker recovery with long-lasting results.
Traditionally they say 10 to 15 years, but with technology improving the way it has, with the plastic materials that typically wear out, with them getting more and more advanced, we see joints are lasting longer, and it would be safe enough to say that most patients that get joints replaced in their late 60s, early 70s, their joints should outlive them.
Of course, taking preventative measures before and after joint replacement surgery contributes to having a good quality of life. Even if a medical procedure is not on your horizon, it is important, especially as you get older, that you take steps to stay grounded. According to the National Safety Council, people over age 55 are most prone to falling, but anyone with muscle weakness or balance and gait problems have greater risk. The number of fall deaths among adults 65 and older is 4 times the number of fall deaths among all other age groups. Diligence is advised in areas where falls most commonly occur, and you may be surprised to know they're places we're most familiar with: the kitchen, the bathroom, and the bedroom.
In my experience, I've noticed that there have been issues with falls, usually at home, because the patient is very familiar with the area and they may have an area that had a loose fitting tile or possibly a rug that kind of buckled, and they should have taken care of it, but because they're in their own environment, they thought they could work their way around it.
As we age, certain medical conditions can further impact our ability to recover from a fall. More than 2 million fractures occur each year related to osteoporosis, which means porous bone and leads to progressively weaker bones.
What we're able to do now with the advent of new medications, we can actually treat this and reverse the loss of bone calcium and prevent fractures that frequently occur in the elderly that can be very devastating. And we can monitor this and see who needs the treatment and how well the treatment is doing with bone density measurements. We're able to do this here, and it's a very simple test, painless. You basically lay down on a table for a couple of minutes, and a very low dose X-ray picture is taken.
The test, known as a DEXA scan, can help identify the potential for bone loss early on, so the patient and her doctors can determine the best approach, with diet or medication, or both. Experts agree the best way to boost the amount of calcium in our bones is through a healthy diet that includes certain calcium-rich food sources combined with regular exercise, which may leave you wondering which foods should you eat, and will you even like them? Waterman Wellness has enlisted a couple of local experts who will regularly help us cook up good health. One of the best ways to treat and prevent osteoporosis is to get vitamin D and calcium through your diet. So here we are in the kitchen to do just that, and we're going to have a tasty treat that not only introduces calcium and vitamin D into your diet, but it has some other nutrients as well.
It does. It has some added fiber, phytonutrients, and antioxidants as well.
And it looks delicious. So let's bring in Chef Dave, and he can tell us a little bit about what's going on here.
Good afternoon, ladies. Today we're going to make a nice springtime dessert. We have rhubarb, strawberries. We're going to make a little mousse out of calcium-rich yogurt and our unsweetened whipped topping.
And so this is something that we can do at home really any time of year, because we could get it fresh or we could get it frozen.
Absolutely. Both are available year-round in the frozen state, and this time of year especially in the fresh state.
We'll get to it because I want to eat it.
I know, I want to sample.
So we're talking about calcium and vitamin D in our diet. Why is it so important to have calcium and vitamin D to fight osteoporosis?
Well, they are the best things to help prevent and treat osteoporosis. And we need to be worried about them right now. If you haven't been consuming them in your diet, you need to start immediately as soon as you can.
So how many servings a day of calcium and vitamin D do we need? And then really, what is a serving?
Well, it's most important to get between 2 to 3 servings of calcium per day to make sure that you're getting enough to help prevent bone deterioration and to help maintain your bone density as well.
And so when you say a serving, is that a spoonful of yogurt? Is it a cup of strawberries? What are we talking about?
Serving sizes for calcium foods for your milk and things like that, it's going to be 1 cup.
Okay.
So 8 fluid ounces. If it's for your yogurt, they usually come in a 6-ounce container, so that would be considered a serving size.
So that makes it easy. But what if you're lactose intolerant?
Well, you can always incorporate soy beverages or almond milk, rice milk. Just make sure that calcium has been added back into it. Generally, all things are best absorbed through food. So we always recommend food first, and if you can't get it enough through your food, then you can go to a supplement.
And it looks like Chef Dave is done with our dessert. That looks and smells delicious. There you have it. This is a delicious, nutritious dessert that is calcium rich, good for your bones, and easy to make. Chef Dave, Stephanie, thank you so much for joining us.
Thank you.
You can find that recipe online at our website. And want to learn more easy, healthy recipes that will put you and your family on the road to wellness? Join the Yum Yum Club. Educational and fun cooking demonstrations are led by a professional chef and a registered dietitian. Each class features an easy-to-prepare recipe. The first Yum Yum Club class in a series will be held on Tuesday, May 27th at 6 p.m. Call 253-3685 or visit ConneryCreationHealth.com. As mentioned earlier, staying active is important to maintaining a healthy body. A healthy lifestyle is especially critical for children, so they develop good habits that decrease the likeliness of common diseases and conditions associated with adulthood. Of course, exercise every day, year-round, is important, but our warm, humid climate can dissuade our kids, and us, from outside activity. According to the American Academy of Pediatrics, children aged 2 and up should have at least 1 hour of physical activity each day, whether broken up into smaller time periods or one session. The activity should be at least moderate in intensity and should cause your child to breathe hard or sweat a bit each day. Dr. Rodriguez has tips for parents to help ensure their children are staying active.
There's different ways you can keep your child active, and actually the best way to do it is break it depending on your child's age. You can go online and research, and there's apps now that you have smartphones, and you can Google like kids activity or kids app, and they will tell you, depending on your age, what things are good for you. If you have a 2-year-old, 3-year-old, you can blow bubbles at them and have them chasing around, so that will keep them active for a little bit. If they're a little bit older, you want to play ball or take them for walks. If they're in the 5 or 6 age range, you can ride a bicycle or engage them in sports activities or competitive sports as well.
If your family leads highly scheduled lives, schedule in time to exercise. Limit sedentary activities such as watching TV, computer time, or video games to no more than 2 hours per day. Keep activity logs so you can monitor daily exercise. Be a role model and help shape your child's perception of exercise. Consider doing it together. Fortunately, there are plenty of resources right here in our community to help us stay on the road to wellness, no matter our age. Here's a list of upcoming classes and seminars available to the community. We hope you've enjoyed this debut episode of Waterman Wellness, your path to healthy living with help from local experts. Be sure to watch for the June episode right here on Lake Sumter TV for some of the following stories. June is time to man up. In honor of Men's Health Month, the Waterman Wellness Nutrition Team will have the recipe for a healthy prostate. What's the best way to stay hydrated during the hot Florida summer? Our local experts will quench your thirst for knowledge. And we'll show you how you can keep safe in the sun. Until next time, I'm Michelle Wargo for Waterman Wellness. For more information on the specialists featured in this episode, please visit fhwaterman.com.